Good afternoon, Albert. How are you today?
Good afternoon. Very well, doctor. Thank you.
I really appreciate you taking time out of your day to speak with us and kind of tell us about your experience with, your prior history of severe headaches and experience with the surgery that you underwent. But let's start by kind of talking about where things were when you and I first met a little over a year ago. What was going on with your symptoms? What had been going on for the previous however many years?
Absolutely. I had persistent headaches that radiated from the back of my head forward. I had severe exhaustion. I had pressure in the back of my head. I had ice pick headaches, that I would call them. I had a tremendous amount of vestibular issues. So the dizziness, nausea, blurred vision, cognitive issues, had a great deal of difficulty concentrating and focusing. Developed some anxiety and depression along the way.
Hmm.
Um, Light, noise sensitive, couldn't go out to bars, restaurants, windows, brightness, would impact me. I had a severe amount of TMD issues, never had jaw issues, never had pain in my jaw before, that complicated matters as well. So I tried a fair amount of things along the way. I tried radio frequency ablations, physical therapy, massage, Botox, MRI, X-rays, acupuncture, PRP, and then countless medications. So quite the gambit before I saw you, doctor.
Right. And how long had you been having symptoms for by the time you and I first met?
It was about 3.5 years of spinning my wheels
Yeah.
until I saw you.
Right. And as long as that may seem, we've said this before, but it's actually been published data now, the average amount of time from the onset of symptoms to someone like yourself sees a peripheral nerve surgeon like myself is sadly 19 years. So remarkably, I think given your background in the medical profession, as a administrator for a very large medical group where you live, um, you were relatively fortunate in that you knew where to look and how to find us. And anyway, at the end of the day, we determined because your symptoms were left-sided that there were three nerves back of the head that needed to be addressed. We operated on those nerves back in August of last year, so it's been just shy of a year. Um, Speak to the recovery a little bit. What was it like, coming out of surgery and the next few weeks and months?
Yes, please. I traveled from Albuquerque, New Mexico to see you in San Francisco. So I traveled there, had the surgery there with you, stayed in a hotel, flew back 2 days later. I wasn't under any pain due to the anesthesia and local sedatives and stuff. And so flew back to Albuquerque. And for the next month, I just took it really easy. I had to uh, take it slow, couldn't do any chores, any housework.
Mhm.
Used ice packs on my head, took some pain medication as needed. I would say the number one issue that I had for the first month was just, as I think you described it, the fuego, the fire in the back of your head. Those are those nerves being manipulated, by yourself. And so that was the most difficult part was the first month. Coming out of the first month, though, that's when I really started to see changes with myself.
Hmm. And hold on one second, buddy. That was my wife. So we'll cut this part out here. Uh,
Unacceptable. Just kidding.
I screwed that up. I'll have my people cut it out. As you can see, I have no ability to multitask. So,
I had to mute everything of mine, and then on the other side of my wall, I have my team over here being loud and obnoxious at the moment. And yeah, I don't. Yeah.
yeah, yeah. All right. So back to the story. Um, Okay, and let's cut to the chase here. We are literally just shy of 1 year. We had these ups and downs, which are all very normal as we discuss preoperatively in the post-operative setting. How are things now? How do you feel?
Happy to
What's going
say
on?
I literally have my life back. I'm at, I would say, about 90%. Every month I've gotten better. I'm able to think now. I'm able to work out. My sleep is amazing. I didn't realize how much I had secluded myself from the world because I couldn't function. And so I'm now getting out there. I've lost, 30 pounds, seeing a nutritionalist, being present in people's lives again
Yeah.
is amazing. I never thought I would have that opportunity. Again, chronic pain is tough. Chronic pain is real. It changes you. Family, friends, very appreciative for their support. Appreciative for you and your support. I couldn't ask for a better outcome, even if at 90%. If that's all I ever get, that's a-okay. I have my life back, so I'm
Well,
quite
that's
happy.
so great to hear because I love helping good people, and I think that it's so gratifying to hear just how much of a difference this can make. I think your point is such a good one that chronic pain, you don't really realize, especially when it's been ongoing for so long, just kind of eats away at a lot of those social interactions and connections that we all really need and crave. And I think what you've pointed out, which I think is so lovely, is that a lot of that stuff can come back once, maybe not 100%, but a good bit of that pain is kind of put off to the side and goes away.
Sure.
You can get those back, and I think that does a lot to kind of your mental state. So,
I
uh,
would agree.
yeah,
Every day was dictated by the pain I was in at any point in time. And at any point, that plan could shift or change depending on whether I felt nauseated or whether I felt dizzy or whether I had a 10 out of 10 migraine. To wake up in the morning with zero pain and is so gratifying. And even if I do have a headache, a frontal headache, a stress headache, having a leave, to leave, and I feel, and it goes away. I can take a nap and the headache goes away.
yeah.
Whereas before, I would get a migraine that would last for hours, days, weeks, months. Doesn't happen anymore.
Yeah, and I think it's so interesting that people are diagnosed with migraines when it's really migraine-like symptoms as a result of nerve compression, because now that that compression's gone, the migraines are gone, or what were called migraine symptoms. So, listen, again, I so appreciate the time you've given us today. Uh, Always leave patients with the last word if you have anything else that you want to say. Otherwise, I'm really grateful for you. You've been a great patient. I'm so glad that you've done so well. And obviously, as I say to everyone else, the door is always open. So should things arise in the future, we're always available to talk about it and try to manage it if we need to.
I appreciate it, doctor. Appreciate you and your staff. Thank you.
You're welcome. Okay.